we can get started. Okay, so today, again, we're going to go over monitoring and reports in Foothold Care Management. And our system does make it easy for users to monitor their progress with their health home members, whether you're a care manager or whether you're kind of taking a look at a team level or even at the agency level. So we do have quite a number of tools in our system to make this easy for our users. Here are some of the monitoring tools that we'll be going over in FCM. I'm sure most of you, especially if you've kind of been using the platform for some time, have used these tools pretty much daily. Hopefully, and they're really just helpful in helping you see the kind of progress that you're doing with your members, and see some of the areas where maybe you need to focus a little bit more on, but we're going to go over them in the system. Just as a reminder, the platform that we are using is like a staging instance, so there won't be any PHI viewable within the staging. It's all kind of anonymized. Okay, so the first screen that we'll be looking at really is our patient index screen. And I'm sure our users are on this screen all the time. It's pretty much the landing page outside of the CM dashboard if you're a care manager. But by default, if you don't have a dashboard, this is where the system will take you. And this screen has quite a number of options to filter information. So depending on what it is that you're looking for, this screen will give you what you need. So in this example here, I'm filtering members that are currently active who have some sort of enrollment or active segment. And then I am focusing on myself as a care manager. And maybe I wanted to look at the diagnosis for any of my members who have asthma, for example. These filters, they are drop downs, but some of them are multi-select. So if I wanted to look at my members who had asthma and maybe cardiovascular disease, then I could include that information and it'll filter down all the members who kind of fill this criteria. Again, it's really up to the user in what it is that they'd like to view from this screen. So perhaps I wanted to see all of the members who maybe had a HARP enrolled code. So again, I just updated the filter here to include that HARP enrolled code, filtered it down to members who had an active enrollment on my caseload, and I'm able to filter that and see all of the members here that fit that criteria. So I have 22 members who are actively enrolled under my caseload who have this H1 HARP code. Additionally, you could export this information as a CSV. So when you export it to a CSV, I use Excel to view the data, and I'm able to see even more information than what's here on the screen. And that includes, all the diagnoses that the members have, depending on, what has been reported. It has demographic information. It has information about latest encounters, their insurance information. So there's a lot more detail within the actual export. So that's really helpful. But this is a great way to kind of help set you up for the members that you want to view and to review. Okay. Now, the next screen that we will go over is the Care Manager dashboard. The Care Manager dashboard, again, is quite popular. It is the landing page if you are a care manager and you log in. This, by default, is typically where you would land, unless you're a supervisor, and then you've got kind of multiple dashboards that you can choose to view from, but we can go over more of that a little later in the presentation. But here on the Care Manager dashboard, we can see that it has all the information. On my dashboard, it has information about how many members I have on my caseload. It is a hyperlink, so if you wanted to click to see who those members are, it will take you to the patient index, which is what we were just looking at. And it'll also show me if I'm part of a supervisory team, which team that is. And again, it is also hyperlinked. And if we click on this, it's going to take me to the actual supervisory team page where I can see this is my team, here are the supervisors on the team, and who is who within the actual team itself. So really helpful information. And we can go over the supervisory team portion again a little bit later in the presentation. And down here, we have our widgets to show our big three metrics that we're measuring. We have our consent rate box here, our assessment rate box, and our assigned care plan rate box. And here we have the percentages of members who have completed their consents, who have a completed assessment, and who have assigned a care plan. So it looks like here I do have some work cut out for me because I do have quite a low percentage rate in terms of completing these two metrics. But the helpful thing here on these pages are right here on the bottom right corner where it has these hyperlinks to the members on my caseload who have these items missing. So if I wanted to see which of these members have an assessment that has not yet been completed, it's going to take me here and I'm able to kind of go down the list, hopefully, schedule some appointments with these members and get these assessments done. Again, similar to the assessment rate, we just did that, but if I wanted to look at the assigned care plan rate, again, it's going to take me back to the patient index screen. Down here, under the big three metrics, we have our gaps in care widget and our care plan change request widgets. Our gaps in care widget is really helpful for our care managers who are looking to help their members close these active gaps in care that are sent by the managed care plans. So the MCOs send data to the health homes, identifying members who have open gaps. So, perhaps they are due for breast cancer screening or an A1C perhaps. And that information is shared then with us and we import that information into our platform. So here it shows me I have 10 members who have active gaps, and of the 10 members, they have a total of 23 gaps that are still open. So if I wanted to look at what that was, then I can go in and I can I have two options. I can click View All Active Gaps, which will take me to the Gaps in Care screen with all of the members. So all of the 10 patients with their 23 active gaps, all on one page so that I can kind of view all in one spot exactly all the information that is regarding their open gaps. So here we can see information regarding the actual gap, the date that it was uploaded into our system, the managed care organization that sent the gap, myself as the care manager, and we also have MCO gap status. And this status means that according to the plan that they see based on their claims information, that this gap has not yet been closed with the provider. The CM status is different in that perhaps you knew and attended an appointment with a member. So you attended an appointment, a nutrition counseling report appointment with a member, and here it's marked as care provided. So here it still shows as active because perhaps the MCO still hasn't received that claim to show that the gap has been closed, but you as a care manager know that you attended that appointment with the member to show that this gap has in fact been closed. If you wanted to update the status of the gaps, you could go and click into the details, and it'll take you directly to the member chart within their gaps in care tab. And here is where a care manager can update the status, whether it's an action needed, which is by default what it'll be. And then care managers can update to show that maybe they're in the process of getting that appointment and they have one scheduled next week. So you'd mark that as in progress. Or maybe the appointment happened 2 weeks ago and you're able to mark that this has been provided. But perhaps there is a discussion with the provider and the gap is not applicable to them, then you could also mark that. Or, if the member is just not ready to address that gap, you can mark that as member refuse. So these statuses are really helpful to show the managed care organization. Maybe you're having discussions with the assigned MCO care manager, and you're able to have these discussions with them about where in the process you are in helping this member get this gap closed, or perhaps again they've refused it at this time. Okay. So that's if we clicked on view all active gaps. But if we wanted to go individually into the members chart, we can also do that. So if I wanted to click on this members chart, and it's going to take me to their chart, and it'll take me to their tab and see that this member has one active gap and there's still action that needs to be done. This next widget, the Care Plan Change Request widget, is the widget that'll show care managers whether or not their supervisor has requested changes to the care plan. So if a care manager submits their care plan to the supervisor to review, and perhaps the supervisor can either approve it, and there's nothing more for them to do, and in that case, there wouldn't be any change requests like in here. But perhaps there is a request to update the care plan with some additional information by the supervisor, and that information will pop up here. So I can show an example of what that would look like. So we see here on Ronald Weasley's dashboard, if you're a Harry Potter fan, you'll notice this name, and you'll notice that Harry Potter fans or Harry Potter names are quite popular when I'm doing the presentation. So if you'll know that. So in this example, we see here the care plan change request was given to this particular care manager by their supervisor. And you'll down here, we have the patient chart. And when you click on it, it'll take you directly to the care plan where the change was requested. Do we have a question? And please feel free to unmute yourself if you have a question, or if you'd like to put it in the chat during the presentation, and I'll be sure to get through the questions, but hopefully we'll have some time towards the end to answer more questions. All right, so this a care plan change was requested by the supervisor for this particular care manager, and once that information has been updated, they can request another review to the supervisor and the supervisor can approve it. So that's this particular widget here on this dashboard. Okay. So the next screen that we're going to go over is our caseload overview screen. This is a really helpful screen for our users because it's just visually a great way to kind of see what these due dates or completion dates are in just one view. It's also helpful because it has these shaded colors for the dates or lack of dates. So it's a great indicator to show me as a care manager that I've got quite a number of my members who have not yet had their assessments completed or have their care plan signed. It kind of mirrors back to the case, the CM dashboard, where it kind of gives me that number at the bottom right corner of those widgets. But here's another way to kind of just reiterate that information, that there are some items that need to be addressed. You can see, all of the dates here for these big three, I guess you could say. And we also have information here about the latest care conference or the latest face-to-face encounter. So, if your health home is looking for that information, or perhaps, based on policy, there are certain requirements for when a care conference is last done or face-to-face encounter is last done, that information can be found here. And this is based on the encounter, the dates, and the drop downs. They do have, or they do capture this information, whether it's a care conference, and whether the encounter is a face-to-face encounter. We also have columns here to show the assessment and the care plans review status. So if you have requested an assessment to be reviewed by your supervisor, that information is captured here, the dates of when they did approve it. Over here, we have the care plan review status as well. So if you have requested a supervisor to approve a care plan, it is here. And if it's still being in the process of being reviewed, you'll also see that it was requested on this date and that it has still yet to be approved by the supervisor. So this view is just by care manager for myself, but if you wanted to, you could see how the overview looks like for a particular team. So if you're part of a team and you wanted to see how all of the care managers were doing that were assigned to you, if you're a supervisor, you could filter by a supervisory team. And now you can see that the care managers have expanded to include some of my Harry Potter pals here on my Dumbledore team. And you can see what their completions look like, if they have any reviews. So as a supervisor, it's a great way to kind of get a look at the team, a team view. Maybe there's a group supervision perhaps, and some opportunity to talk about areas where the team can feel more supported or get additional support, or a supervisor can, take a look at this at a care manager level for some one-on-one supervision and see where some additional support is needed at that level. This report is also exportable as a CSV. So if you wanted to see this and maybe filter it, perhaps drill down by date or any items that are missing, you can do so on the spreadsheet after downloading it. Okay. Our next window is our caseload coverage window. This is a window that I like to show, and that I like personally, just because visually I like seeing all these little icons across the span of the month that I'm looking at. How many of you all think that this window is quite helpful or use it quite often? Give a thumbs up or another emoji if you enjoy using this particular window and find it helpful. I like it because I can see, as a user, I want to see what kind of work I've been doing all month, and in this view for the month of February, I see that quite a number of phone calls have happened for my caseload. There are also other encounter types that I can see. So if you hover over the icon, it'll tell you exactly what kind of encounter was had. So for this one, where it has like the little bubble with some dots in it, it looks like a text was sent to the patient. And then we have here the little briefcase. It looks like a care conference was had with the providers and the member. You'll also notice that these icons are shaded differently. So if they are this black icon, it means that some sort of successful encounter has happened. However, if there is this lighter shaded gray icon, then there was an attempt, but it doesn't look like it was successful in reaching somebody. Again, the different icons will show the different kinds of encounters that you have. So we have like in person, we have emails. So really helpful visually for myself, and it looks like several users also find this helpful. So we're glad that it has been helpful. Again, up here, you can filter this as needed. So perhaps you wanted to look at all the members who are enrolled, or maybe you wanted to see all the members who were in diligent search. I'm not sure if I have any here. I don't. But if you do, then that could be, again, a helpful way to kind of keep track of all the members who were pended, and how many encounters or attempts have been made to get in contact with that member. If we wanted to see how many of my members didn't have a billable encounter in the month yet, maybe it's mid-month and I want to be able to ensure that I've captured everybody for the month, this could also be a good way to see whether or not I missed anyone. Let's see if I missed anyone here. It looks like I have one member who has not had a billable encounter for the month, and then I can go back and see if I can attempt to reach out to this member and see, what's been going on this month. Excuse me. I have a question about a copy of the recording, and the recording will be posted up on our support page. The next window that we're going to look at is our billing support window. So our billing support window is really helpful for users who want to get an idea of what their progress looks like for the month in terms of completing their billing support questionnaires. So I have here by default, I already have it filtered down to dates of service for the month of February, and perhaps I completed questionnaires, but it still looks like they're unsynced. And I would want to see, are they unsynced because perhaps I completed it and it just hasn't, my health home's turn hasn't happened yet in terms of syncing up with MAP, or is it unsynced because there's some sort of error that's associated with that with the status. So here I have it, does it have errors? Yes, and I did complete the questionnaire, but it hasn't yet submitted to MAP. So why is that? And we can see here an overview of all of the members that have a questionnaire but hasn't yet been synced. And these little blue exclamation point boxes are going to tell me exactly why that is. So if I hover over it, if I click on it, it's going to tell me that there's an error uploading to MAP because this member is not Medicaid eligible. So then at this point, I would go in and check on the member chart. And then I could take a look at the insurance details here. And usually it'll have, our nightly sync will show the latest date. And it shows here the Medicaid type that it is inactive. If I wanted to further confirm, then I could log into ePaces and see what that looks like. But it looks like that this questionnaire isn't going to submit because their Medicaid hasn't been active for that month, that reporting month. We also have quite a number of errors that are quite common in terms of billing support questionnaire errors. So this error, it looks like this member qualifies for Adult Home Plus field R. This is a popular error, and we actually, because it is a support ticket item that we do see quite often. We do have an article in our support pages that tells our users exactly how to fix an error like this. So for example, we have here member qualifies for Adult Home Plus, but perhaps the actual questionnaire had that question answered in a different way. So if I go to our support page, which can easily be found here at the support and the support and training, it's going to take me to our support page, and I actually have it here. And the article is Fixing Billing Support Questionnaire Errors, and it's actually the top error right here at the very beginning. So we do have a guide, so to say, it's for our users on how to fix it. So we've got screenshots, and hopefully that's helpful. And we've got guides on exactly what it is that you need to do to be able to fix this error and get it to sync up to Map. Just a little plug for our support pages. Okay, so once that's done, you can actually go and edit the questionnaires directly from this page versus having to go individually into each chart to do that. But so this is why I find this particular page so helpful, is because it is actionable from this page, which I hope is helpful to our users as well. Okay. So we have a similar window here with a tracking and billing support status. And this window can tell me similar information um, for my members. Again, there are quite a number of filters here, and you can filter as needed. So maybe I want to see all of the members that I have who don't have a billing instance, and I wonder why that would be. Well, we have here for outreach, and this makes sense because there aren't any billing instances for outreach. But if you had a member who was enrolled and didn't have a billing instance, perhaps it's because the member had some sort of tracking error that is preventing them from getting synced up to MAP and capturing a billing support questionnaire. So that information, or this window rather, is helpful in being able to identify those kinds of members. So let's see if I can find and expand the search. Okay, so we see down here, we've got a couple of members whose segment, like this, for example, has not yet been submitted into MAP, and it shows me that I have an error here. So for this particular member, it looks like this segment hasn't yet been reported. And if we hover down here, if we go down to the tracking records, it's going to tell us why. And it's going to show us that the member is under 21 and we have to use a health home children's referral portal. So this is quite frequent in terms of errors, especially for members who are under 21. And that's because members who are under 21 need to have their segments created in two platforms, within FCM and within MAP itself, again, via the children's portal, because there are additional questions that need to be answered by the care manager or by the CMA that isn't available for us to do through our platform. So if again, we also have a support article on specifically for members who are under 21 in our support page that tells us how to fix that. But to fix this particular error, a user again would have to go into MAP and enter in that segment. It's important to note that the segment must be present in both platforms on the same day. If the segment is only existing in FCM, then this is the error that we're going to get and it's not going to push through. If the segment only exists in MAP, and not in FCM, because FCM is the source of truth, it'll think that that segment does not belong in MAP because it doesn't exist in FCM, and it will cancel that segment in MAP. So it's really important to ensure that if you have members under 21 and you need to put them in, into MAP first, or into MAP and FCM on the same day. Okay. So this report is exportable to Excel as an Excel file. And again, there are additional information in the spreadsheet, including break codes, errors, and it'll kind of spell out exactly what the errors are, and you can filter down and address them as needed. Our next window is a window we actually saw a little earlier when we were going over our CM dashboard, and it's the gaps in care window. Again, it's just an overview of all of the members who have gaps in care as identified by the MCO. But up here, you can filter it again. You can drill it down. Perhaps you wanted to focus on only the members who had, let's see if we have any. Doesn't look like it, but if we wanted to focus on one particular MCO, maybe you're scheduled to have a conference call with Health First care managers, and they wanted to review their Health First members with you. This would be, a helpful window to have open during the discussion, so you can kind of see exactly what it is. The status of the members who have Health First. Perhaps they wanted to know what the status is for this particular member, and you can say, well, we actually have an appointment scheduled. I do see here that we have some items in progress, or maybe they are still seeing that this particular gap is still active, but based on the status that the care manager entered in, it shows that the care was provided. So it's a really helpful way to kind of show um, the activity that you're doing with the member in a way that the managed care organization doesn't have access to. So a really great way to showcase all the hard work that you're doing with their members. Does anybody use this particular screen or have used it in their discussions with their MCO care managers, perhaps? Thumbs up. If not, that's also fine. The next screen here is the HCBS report. And this report is for those who have members that are HARP enrolled and are perhaps receiving HCBS or receiving HCBS, we don't yet have a core report, but stay tuned in the coming months. We hope to have a similar report for members who are receiving those services. But this report is to show members within a care management agency, and specifically in this particular screen, I have it filtered to myself. So if I wanted to see, or know all the members that are enrolled and that are HARP enrolled members, and I wanted to know exactly, how many of my members confirm that they're interested in receiving HCBS, or maybe I still have right here, I've still got 20 members who have not yet had a status updated. These are hyperlinked, and if we click on the hyperlink, again, it's going to take me to our patient index screen, and it's going to give me all the members that have yet to whether confirm or kind of decline their interest in HCBS. And then as there is interest confirmed, then we can go to see which of these members had a referral made to services or had an assessment completed. This information can be downloaded just like this as a summary, or if they wanted to know more details, there is a download details report as well. So if you're a supervisor perhaps and you wanted to see at a care management agency level, you can choose your agency up here and just clear out the care managers. This report was somewhat recently revamped. So do we have any users here that have since used it since it's, I guess, refresh? Thumbs up if you have and find it helpful. We hope that it has been helpful to our users, but we know that there are some wish lists for a similar report for core for members who are also receiving core services. So stay tuned. We know that it is um, a request by our users. All right. So we've gone over a number of care management tools that care managers and supervisors alike can use, but we do have some TSP admin tools that are kind of targeted towards that particular role that are coming up. So we went over our care manager dashboard, but we also have some additional dashboards to look at if you're a DSP admin. So here, where we can find that are our reports page. So that's under manage and then down here on the reports page. And it's going to give us some additional reports that TSP admins have access to. And for the purpose of the dashboards, we have here, we went over our care manager dashboard, but we also have a care management agency dashboard. So our care management agency dashboard gives us an overview. Again, we have our big three buckets up here at the agency level. And so we can see that for our particular care management agency, our consent rates are at a 96%. We do have assessment rates at 40, and we don't have any signed care plans. And so that's definitely, some topics to address. Again, we have here these hyperlinks to these patients who are still having these items missing. Again, it'll take us right back to our patient index screen where we can address them from that window. We have here on the bottom left-hand side that I don't think we saw on our care manager dashboard for the care managers that we were looking at, but at an agency level, it shows that we have 63 patients who have assessments that are due within 30 days. If we scroll down, we can also see that it'll break down the information for active patients within the agencies. It'll break down members who are, have fee for service or have managed care plans. We can also see how many of our enrolled members have inactive Medicaid. So that's definitely something to address. On the right-hand side here, we have a DOH tracking. And so we have here, it shows that we've got outreach segments that have been longer than the policy allows and need closure. So if we have members who are in outreach, maybe you opened it 4 months ago and completely forgot that they were still open. This is where you would go to find that and close the segments appropriately so that you can see that they're no longer kind of just outstanding. Down here, you have members who have not yet been accepted by the DOH tracking. So these are the members whose segments have errors on them and have not yet reported to MAP. So this is another way to find who those members are and fix those errors so that you can either get them fixed and submitted to MAP or address them at the member level. Maybe their Medicaid has been inactive or they missed recertification perhaps. And this is an opportunity for the care manager to go and have that discussion with the member and assist them with getting their Medicaid reactivated. Down here, we are capturing information about members who have identified these conditions. So they're diagnosed and it kind of gives you a count of how many members have this particular diagnosis and the percentage of the total member population. So interesting information if that's, maybe information that you wanted to share to the MCO or to your health home. This is what the member population looks like. Perhaps this is information that a care manager or care management agency can use in identifying resources or programs for members, because there is a quite large number of members with depression or hypertension. Maybe there's a particular clinic or facility that have programs that your care managers or can refer their members to. So this information is, I think, is pretty cool and helpful. And then down here, it just kind of gives a breakdown of the members enrolled in a managed care organization. So how many of our users use the care management agency dashboard? Sometimes when I bring this up in support tickets, they didn't know that it existed, or maybe perhaps it's been quite some time since they've utilized it, and they they think it's cool or helpful. I like to think this part up here is helpful as well, um, but it's also a helpful tool to see just kind of across the agency what the big three metrics look like. Okay, and then we went over our care manager dashboard, but we also have the supervisor dashboard. So here we have Dumbledore's Army, and because I'm part of this team, I have it here um, on my as a supervisor dashboard. If you wanted to look at the different teams within your agency, there is a drop down to on the top right here, and you can take a look at that. But for here, we can see again the big three metrics: the consent, assessment, and signed care plan rates. And so these are the completion rates for my particular team. And if we click on these little carrots down here, the widget's going to expand to show me all of the team members that I have and what I guess like what their status is in terms of items that are missing or items that are due within 30 days. Again, these are hyperlinked. It's going to take me right back to that patient index screen. Again, that screen is very popular and it's helpful, and it's going to go there by default to help our users kind of focus on the members who do need some addressing. So again, another useful tool as a supervisor to kind of focus on discussions around where, as a supervisor, I can support. Neville's got 7, missing or expired care plan signatures. Perhaps that's something that we can discuss during supervision about, are there scheduling constraints? Are members not willing to meet in person, or those discussions can be had and can start here on the dashboard. Down here on this particular widget, we have the care plan review requests. And again, this is where care managers request from their supervisors to review the care plans that they've done with their members. And so I've got 3 patients who need some reviewing. So if we click on the member name, it'll take me to the care plan exactly. And we see here that it was requested. And so I'm just going to review it. And if there are any items that need some addressing, then as a supervisor, I can request that or I can approve it as well. I believe that information is here under the info button of the care plan. And here I can either approve it or request changes. Okay, we have someone say that they haven't utilized it, but will now. I'm so glad that you will. We do hope that this is helpful. And this supervisor dashboard has been requested for some time, and we released it a few months ago. It has been quite popular, just kind of based on the sheer number of teams that we have in our system, which is quite high. I think it's in the hundreds. So it is quite popular, and we hope that our users love using it. And if you have any feedback about how to, make this even more helpful to you all, would love to hear that. Feel free to drop it in the comments or send an email to our help desk. Okay. We have another screen, and it's actually going to take me there using, I believe it's this hyperlink. So if we wanted to view the status by care manager, let's click this hyperlink. And it's going to take us, yep, to the Care Management Agency quality screen. So here is another window. Again, it's kind of similar to some of the other windows we were looking at. I believe like the caseload, was it caseload coverage, caseload overview. Um, and it's, again, giving me information about the consents, assessments, and care plans. But it is giving it to me by care manager. So similar to how it looks in the widgets, it's just here it is again, excuse me, and it'll give me, again, information like in the widget where it's giving me how many does this particular team member have missing consents, and this member, it's giving me how many valid consents we have and the completion rates for everyone on the team. So if we click on the next buttons, it's going to give me, again, similar information to what's in the supervisor dashboard in the widget, but it's going to just kind of give me a little bit more information and percentages. Same thing with the care plans. So really helpful, I hope, to our users. Another neat and new thing on this page is that you can also view it. We viewed it by supervisory team, but we can also view it by supervisor. So maybe we want to focus on Hermione, because maybe Hermione has 3 supervisory teams that she's overseeing. And that's quite true for, based on what I've seen in supervisory teams, that one individual can have oversight of multiple teams, and maybe you wanted to see what that looked like, what that work looked like for one supervisor versus just looking at one team, which is what we did before. But these are multi-select, so if you wanted to, you could choose more than one. Or you can look at specifically one care manager. So we've got me, and this is what it looks like, which should also mirror what's on my dashboard. This is exportable to CSV as well. So more information on the spreadsheet, more opportunities to filter down exactly what it is that you wanted to take a look at. So again, really useful tool. If you're a supervisor and a care manager, like if you have a caseload, then this button up here, this dashboard button, should show up on your account or on your page where you can choose the dashboard that you want to look at. So if I wanted to go back to the dashboard and look at my team, then I can just choose that. If I wanted to look at my own CM dashboard, then I'll click on that link and search for my name, and it'll take me there. If you're a care manager and you're not a supervisor, by default, when you log in, again, this page will pop up, but perhaps you've got a ton of windows open like I do now. And I wanted to get to my dashboard real quick. This icon, this Foothold icon, if you click on it, it'll take you to your dashboard. So a really cool tool that I didn't know was even there until this year, and I've been using the platform for probably 5-6 years now. So if you didn't know, now you know. All right. Okay, so we have additional windows here if you are a DSP admin, and these are based off of some common help desk questions or tickets that I do receive. And so we have here our configuration window. So again, from manage to configuration, and it's going to take me here. And this is where I can see users, care managers, and supervisory teams. So here on the user page, this is where, as a DSP admin, I can create a new user or perhaps look up a new user. So here I have a new user that I just created today. I've got Draco Malfoy. I have his information here. He's currently active, but I don't see a linked resource here. So one of the questions that I do receive is, how come I can't find my care manager in the drop-down menu? I can't assign them to a caseload. And this is where I would look as a DSP admin. This is the first place I'd look. I'd search for their name and I'd see if they have a linked resource. If they don't, that's why they're not popping up in the drop-down. So what you need to do here is go back to your configurations page, go to the care managers, which is another, like a separate profile that then gets linked to the user. So we have here, I'm in the care manager page and I search for this particular member, didn't come up, so I can create them. And here I created Draco Malfoy. He's active. He's under my care management agency. But it shows down here, no user is linked to this care manager. So once this care manager has been created under the care manager configuration, when I go back to Draco's profile under users, I'm going to edit. And all the way down here where it says care manager link, I'm going to look for his name. And I'm going to update the user. And now when I go back to the user page, I'll see here the linked resource is Draco. And now this user can be chosen as a care manager and can be assigned to members. This is where this user will be able to see their CM dashboard if they had not been able to see their CM dashboard before. This is why. So again, a pretty common help desk ticket, but this is how this particular ticket gets resolved. The other configuration was a supervisory team. So we talked about supervisory teams and how in the different windows we were able to click into it. But if you're a DSP admin and you wanted to create a new team, you can do so from Manage Configuration and Supervisory Teams. So it's as simple as clicking on the New Team button. You can choose the team name, your care management agency, and then you can go on and create your team. Now we don't have any supervisors or care managers yet, and it's as simple, again, as adding a supervisor. Maybe I wanted to add Hermione again to oversee another team. And perhaps so far, Hermione's overseeing two of the care managers. And that's it. It's as simple as that. So, and it's also easily configurable. So if you wanted to remove someone, you can remove them or add additional people, you can do so. When you go back to supervisory teams, you'll see here the new team with the little caret to expand, and you'll see who's who on the team when it was last updated. I think it is sorted by alphabetical order, which I think is more helpful than when it was last updated. All right. One other item or one other question that comes up in a support ticket is perhaps a member was transferred to a new care management agency, but like I forgot to enter in an encounter right before they transferred over, but you no longer have access to that member's record, right? Because they transferred to a new agency. That's okay. We can actually access a historical version of a member's chart when it belonged to your care management agency. How many times has this happened to any users here? Thumbs up if this has happened to you. It's okay, no judgments. I'm sure, it is something that I do see in the support tickets. If you don't want to admit it, that's okay too. But I can show you how to address that. So we can go back to manage, go to reports, and right here under historical data, transferred patients. And it's going to give me here, usually it's blank, but for this purpose, if we wanted to search for a particular member that you no longer have access to the chart, but you know that you had served them under your agency, you can type in their SIN here and filter. I chose one particular member. And here we have, it looks similar to the member chart, right? The tabs on the left-hand side. So here under encounters, if I wanted to be able to add that last encounter that I wasn't able to add before the member was transferred over to the next care management agency, I can click on new encounter. Maybe put in that last note that you had helped the member, I don't know, with their.
Oh, I see her coming back now. Here she is. Sorry
Oh,
about that.
sorry about that,
You're
everyone.
back. Okay, I wasn't sure if it was just my internet,
No, it was
or
definitely
not,
me.
but we're glad to see you back.
Thanks. Thank you. Thank you. Okay, sorry about that. Let me get back into sharing my screen.
Oh, thanks, Christine.
All right. Can you see it now?
Yeah, you're all set. We're back on track.
Okay, great. All right. So if you wanted to add the encounter for, maybe you wanted to add that you had referred this member uh, to get their Medicaid completed. You can actually add that here and save it. And that'll be that. So you don't have to feel guilty about being by missing one last encounter before the user was transferred over to a new agency. Okay. All right. Hey, apologies. I'm just getting my notes. Okay. Um, all right. I think I covered a number of the items that I wanted to cover in terms of monitoring and reports. Oh, we have one here. The encounters report. If users or DSP admins, for example, wanted to be able to see or use this function of logging encounters as a supervisory tool, then this is the place where users or DSP admins can do that. So again, we would go to Manage, Reports, and Encounters. This is under Historical Data. And this is a screen where, again, you can filter down more information. For this purpose, I looked at encounters that were created between April and September. And I see here that, and the status is unlocked. And if I were the supervisor, then I would want to go in and be able to lock this particular encounter. And we have here the encounter that was created and is not locked, but everything looks good on my end as a supervisor. And so if I wanted to lock it, I can lock it just clicking the lock encounter. So it'll give here a timestamp of when that was done. And as a DSP admin, if perhaps like, oops, I didn't mean to lock it, I can unlock it. However, if it is locked by someone else, like the care manager, then this would not, this option to unlock would not be available to them. Only DSP admins can unlock locked encounters. Again, that's not a requirement, and it is used by it is up to the care management agency to determine whether or not their users are required to do that. But it is a helpful feature for supervisory purposes, I think. Okay. So I guess the last thing that I wanted to highlight was the support page. Again, this is a really helpful page for our users where there are a lot of resources in terms of articles or videos for those who are looking for how to do something, how to fix something, how to, learn something new, perhaps. This right here on this button using Foothold Care Management are the different articles that we have. If you're new to Foothold and want to learn more about how to access it, if you're a DSP admin and maybe you want to be able to reactivate a deactivated user, we do have an article on exactly how to do that with screenshots involved as well. And we hope that that's useful or helpful to our DSP admins.
Hi, Christine.
Yes.
I just had a question with the encounters report.
Sure.
There's not a way to run the report where you can have the notes also come up and press lock without having to go into each individual note in each individual chart for
Right.
the.
I don't believe we have that function because we don't have the encounter actually here to view from this particular page. But that's some feedback that we can take back to our team.
Yes, that would be very helpful, especially, depending on the size of the CMA, you may be looking at hundreds of encounters and having to go into each one and then navigate back to the pages a lot.
Right. Yeah, no, that's really helpful information. And I believe we probably have heard it. I think I might have heard it one other time, but it's always good to continue to hear feedback from our users and see, how important a feature like that would be to them. So thank you for sharing that.
Hi, this is Ryan. Another small tip which may be helpful, and Christine, apologies if you covered this already, but because right, I know it's a pain if you have to click on it, then go in and then come back to the screen and potentially refilter. So just kind of right clicking to open up that record in a separate tab, and then that way you kind of will always have this encounter screen up without having to kind of re-navigate to everything.
Yeah, I use that. It's just I was previously an awards user, and so it was a feature that we had for there, and I know how easier it makes reviewing
Yeah,
on.
I hear you.
Yeah.
Yeah. Yeah, we'll definitely bring that back.
Thank you. Okay, were there any other questions on any of the information that we've gone over today, or perhaps there was something that you wanted to take a peek at that we hadn't yet kind of touched? Right. Well, if not, that is the end of the presentation. If you do come across a question that comes to your mind afterwards, feel free to reach out to our help desk. Here's our email address right here on the page.